Dental bridges are the most common procedure in dentistry used to repair any missing tooth. It's a permanent dental restoration which is fixed to the teeth of the natural in the opposite direction of the gap created by the tooth missing. This video outlines the steps to obtain the dental bridge. This includes first consultations, the preparation for the tooth, as well as installation of the bridge. Initial consultation. The first step towards getting a bridge for your dental needs is to set up an initial visit by your dentist. At this time, your dentist will review the condition of your teeth and go over possible options to replace the lost tooth. Additionally, they will collect X-rays as well as impressions of your teeth for the perfect bridge for the mouth exactly. Preparation of the teeth. After you've made the decision to make a decision on using a bridge made of dental material, then the next thing to do is to prepare the tooth that will hold the bridge. The process typically involves taking the enamel off the natural teeth that lie on each side between the gaps. The procedure is designed to allow enough space to fit the crowns, which will keep the bridge in place. Your dentist will also create a second set of impressions of your mouth to confirm that your bridge will fit properly. These impressions will then be transferred to a dental laboratory in which the bridge is made to be custom fitted to the appearance and color of your natural teeth. Placement of the bridge. After the custom-made bridge is complete, you'll go back to your dentist's office for the final fitting. Your dentist will test the fit of your bridge to confirm that it fits comfortably inside the mouth. They can make some modifications to your bridge as needed. Dental crowns which hold the bridge together will be bonded to the teeth naturally. The bridge is placed in its place and your dentist will then make any adjustments necessary to make sure that your bite is natural and natural. Aftercare. When the bridge is set, your dentist will then provide you with guidelines on how to maintain it in a proper manner. The best way to do this is by avoidance of sticky or hard foods that can damage the bridge, as well as ensuring good oral hygiene through flossing and brushing your teeth regularly. It is possible to experience sensations of sensitivity or discomfort in the following days following the installation of your bridge. However, the discomfort should diminish after your mouth has adjusted to the new structure. If you continue to experience discomfort, be aware that you should contact your dentist. Every 6 months, regular visits to your dentist is essential in order to check the bridge you have chosen to use is operating properly, and also to assess the health of your own natural teeth. When properly cared for, your dental bridge could endure for years and will give you confidence when you smile. To conclude, obtaining an implant for your dental is a simple process that could help to make your smile look better and enhance your dental health. Following the instructions in this tutorial and in close collaboration along with your dentist, you'll be able to get a gorgeous and effective dental restoration that can last for a long time.